If you've ever considered weight loss surgery, listen to this. There is a newer technique. It's called the gastric sleeve, and on average, patients who have it show a 60% drop in excess body weight within 1 to 2 years. Joining me is Dr. Dan Jones, Director of the Minimally Invasive and Bariatric Surgery Program at Beth Israel Deaconess Medical Center in Boston. So good to have you with us.
Nice to be here.
Explain to us how this new sleeve procedure works, and how is it different from other procedures that we know of?
Well, we basically have 3 operations we've been doing. We have the gastric bypass, which cuts off the top of the stomach, connects a piece of bowel, and it's malabsorptive. It's the most radical of the operations we have. On the other extreme, we have the band, which puts a belt around the top of the stomach. It can be tightened and loosened, creating a small stomach above the band. Right in between this, we found this new operation called the gastric sleeve. So what that does is it takes a larger stomach and really just downsizes it. So you take a cantaloupe and you bring it down to a banana, and we call that the sleeve. And what happens is those cells that used to be in the stomach that got cut out are no longer there going to the brain saying, hey, feed me, the stomach's empty. Instead, what's happening is you go to a meal because it's time to eat, not because you have this strong craving. And when you eat a little bit of food, you go, huh, I'm full, I'm ready to stop. And so that's really the procedure. It's sort of the sweet zone between the band and the bypass for a lot of patients. Now, we still have a lot of patients doing bands, a lot doing bypass, but more and more patients are coming forward and saying, hey, I want to do this operation that's not rearranging things, nor does it have the plastic and all the fills. And for a lot of folks, it's working really nicely.
What are some other benefits of the sleeve? Why do you like it?
Well, again, the advantage is it's effective. And so we can expect that patients are going to lose a good chunk of weight. And as that weight comes off, the diabetes, the sleep apnea, the hypertension, the back pain, the knee pain, all these things go into remission and get better. So we like it when the patient likes it, and we can see these health advantages. Again, these advantages come no matter how the weight comes off. If it can come off with diet, exercise, sleeves, bypass, but for a lot of folks, the sweet point is this sleeve procedure.
When patients come to you now with all of these options, how do you decide which is best tailored for them?
Well, it's nice to have options, and the idea of informed consent is the patient goes through the process of figuring out which operation is right for them. So the way a patient should do that is to come to an accredited bariatric program, learn all they can about sleeves, bands, and bypass, and see what fits their interests best. Each one of them has some nuances that they need to sort through to figure out what's right for them, or if an operation is right for them at all.
And that's my next question. How do you know when an operation is right for you at all? You've tried every diet, you've yo-yoed your whole life. When is it time to land on your doorstep and then eventually on your operating table?
Well, surgery is not for everyone, but for a lot of folks, it's the answer that it's the help they need to kind of get the weight off. In general, our patients are about 100 pounds or more overweight. So it's not about losing 5 or 10 pounds and fitting into your spring clothing. It's really about making a major impact in your health and getting rid of those comorbid weight-related conditions we talked about earlier. You need to do your homework, and so you're going to need to go on. You can start with the web page on Channel 5, come to a BIDMC information session, or one of the accredited programs around town. They all have great sessions. Learn about the surgeries, talk to your family, bring your family with you to the sessions, and figure out if there's a good match and whether you're ready. You'll know when you're ready to exercise a little bit more, cut out the desserts, pay attention to the restrictions you'll have with these operations. But for a lot of people, it's because the health problems are getting too much. The diabetes is adding on, the medicines for back and knee pain become overwhelming. They say, listen, enough's enough. I need to do something. I need a little something more to get me over the hump.
Such helpful information. So good to have you with us. Thank you.
Glad to help.
All right. Well, we know where to find you. Thanks so much. Dr. Dan Jones, good to have you with us.